Welcome back to Eating Well with Diabetes. My name is Phoebe and I am one of the dietitians here at Lompoc Valley Medical Center. In part 3 of Eating Well with Diabetes, we are going to introduce the nutrition label, the plate method, and portioning in the context of diabetes. In this video, we will cover the nutrition facts label, building a balanced plate, portioning guidelines, and talk about one of my favorite nutrition topics, snacks. We will start with introducing label reading. You may be someone who has never looked at a nutrition facts label or someone who looks at them religiously. The main thing I want you to focus on is the serving size. Serving sizes are the portion of food that the numbers are referring to. On this nutrition facts label, a serving size is 2/3 a cup and there are 8 servings per container. The next thing on the label is total grams of fat. This is important to look at depending on your specific health needs. Ask a member of your treatment team for advice on this. Next, we have total grams of carbohydrates. Understanding how many grams of carbohydrates are in a portion is vital for adequate blood glucose control. We want no more than 40 to 60 grams of carbohydrates per meal and 15 to 30 grams of carbohydrates per snack. Finally, our goal is to have lots of dietary fiber and minimum total and added sugar. When choosing between two products, a good rule of thumb would be to look at which one has more fiber and which one has less added sugar. Another way you may see a nutrition facts label is split into a per serving section and a per container section. These foods typically have the entire package eaten, but could have 2 to 3 portion sizes. Some example of these foods are small bags of chips, larger individual sized sodas and juices, packs of cookies, and breakfast or granola bars. We are now going to practice reading a food label. Pictured here are some cookies with the corresponding food label. Can you accurately read this food label? Let's find out. Take a second to pause this video to see if you can answer these 3 questions. How many calories are in one serving? How many grams of carbohydrates would you eat if you had 3 cookies? And how many cookies come in one container? We will go over the answers in the subsequent slides. Let's look at our first question. How many calories are there in one serving? The answer is 160. This typically is going to be the biggest number on our food labels. Number 2, how many grams of carbohydrates would you eat if you had 3 cookies? This one required you to do a little bit of math. The nutrition facts label wording it as total carbohydrate can be confusing because it makes it seem like it is the total for the whole box of cookies. However, this nutrition label says that the serving size is 1 cookie and all of the subsequent information is just for 1 cookie. If you were to eat 3 cookies at 20 grams of carbohydrates each, that would be 60 grams total carbohydrate. Lastly, the container has 24 cookies total, which is typically indicated at the top of the nutrition label. Great work with that exercise. Let's talk about portioning using the plate method. The plate method is my favorite way to teach portioning, and what I find to be the most helpful for clients with and without diabetes. The plate method is having 1/2 of your plate being non-starchy vegetables, 1/4 of your plate being protein, and the other 1/4 being grains and starches. What I love about the plate method is that it's so simple. It can be easily visualized, making it something that you can use anywhere in any sort of food setting. Here are examples of the plate method meals, all of which look absolutely delicious to me. With the plate method, we are able to maintain appropriate portion sizes and get a variety of nutrients. Not all plates are going to be 3 separate components. Some meals are combination foods, like casseroles, lasagnas, and soups. When we are eating combination foods, we want to think about each component separately. Our goal is to consume the combination food like it was spread out on our plate, like choosing to eat more of the vegetable component than the protein or carbohydrate component. Combination foods are where you want to pay attention closely to the nutrition facts label. If you home cook combination foods, like the lasagna pictured here, you can Google how much carbohydrate is in a standard piece. Just try your best, but do not put pressure on yourself to make it perfect. Portioning food through measuring tools and scales can be really beneficial for some people wanting to accurately ensure their portion sizes. However, the majority of people don't have time to pull out measuring tools every time it's time to plan a meal. We can use visual references, like our hands and household items, to guesstimate portion sizes without needing the extra equipment. Personally, my favorite way to portion is to keep things simple, using everyday items that we may find around the house to accurately portion. These are called visual references. They are based on the numerical nutrition recommendations for portioning each macronutrient. For carbohydrates, a standard portion is 1 cup, or 1 baseball. For protein, it is 5 ounces, or 1 deck of cards. You can also use the palm of your hand for this reference. For fat, about 2 tablespoons, or 1 ping pong ball, is our standard portion size. Let's use one of our plate examples from earlier to determine these portion sizes using visual references. Here we have about half a baseball of rice, 1 to 1.5 baseballs of non-starchy vegetables, and 1 deck of cards grilled chicken, along with half a ping pong ball of our oil or butter that we probably cooked that chicken in. This is the same plate with the same portions, but this time we are using numerical references instead of visual references. Our rice is about half a cup, the non-starchy vegetables are about 1 to 1.5 cups, our chicken is about 5 ounces, and our oil or butter used to cook the chicken is about 1 tablespoon. Now it's your turn. Pause the video and try to come up with what the portions are of this spaghetti, grilled chicken, and salad plate. Use visual references, so our baseball, our deck of cards, and our ping pong ball, for this example. For the sake of the activity, let's say that there's a dressing, which would be our fat source, on the salad. Let's go over the visual portions for this example. Here we have about half a baseball of pasta, 1 to 1.5 baseballs of salad, about 1 ping pong ball of dressing, and 1 deck of cards chicken. It is likely that there's about half a ping pong ball, oil, or butter to cook the chicken as well, but it's totally okay if you left that off. This time, I am going to have you pause the video and use numerical references for portioning. These will be the actual measurements that correspond to the portion sizes. The numerical references are 1/2 cup pasta, 1 to 1.5 cups salad with about 2 tablespoons of dressing, about 5 ounces of chicken, likely cooked in about 1 tablespoon of oil or butter. The last thing we are going to talk about in this section is snacks. Snacks are a wonderful way to maintain satiety throughout the day and get extra nutrients. There is no shame in reaching for a snack in between meals if your body is telling you that you need it. It can be especially important before a workout or when you are out of your typical routine like a travel day. The things we want to keep in mind with snacks are aiming for all snacks to be complete snacks, meaning that they consist of at least 2 components, always pairing our carbohydrate snacks with a fat and a protein source, aiming for no more than 15 to 30 grams of carbohydrate per snack. Some examples of complete snacks are fruit and nut butter, dairy and crackers, veggies and hummus, and mixed nuts and popcorn. Notice how we are pairing all of the carbohydrate sources, the fruit, veggies, cracker, and popcorn, with a fat or protein source, the nut butter, hummus, dairy, and mixed nuts. This is vital for regulated blood glucose. If you have been around diabetes treatment for a while, you may remember or use carbohydrate counting. Carbohydrate counting is defined as counting grams of carbohydrates per meal and snack using an exchange system. The exchange system is 1 exchange for every 15 grams of carbohydrates. As an example, a 30-gram carbohydrate large apple would be 2 carbohydrate exchanges. Carbohydrate counting can be helpful for type 1 diabetes management, but mostly just causes stress and overwhelm for individuals. If this is something that works for you, there's no problem in continuing it, but it is not something we like to focus on in individual sessions for people with new diagnoses of diabetes. If you would like to learn more about carb counting, feel free to ask a treatment team member. Great work making it through part 3 of Eating Well with Diabetes. Our 4th and final video, Lifestyle Considerations and Helpful Resources, is up next.